Okay, so today I'm going to be talking to Anna Middleton, who is a dental hygienist and therapist. And she is going to be talking all about how teeth and oral hygiene affect us as we age and what we can do to optimize aging from an oral hygiene perspective. So, Anna, first off, how can we optimize aging when it comes to oral hygiene, and what do we need to consider?
So, first of all, I think there's a couple of things, and this is often what makes oral health and dental health quite complicated at times because the truth is, it's not just about your teeth. There's a lot of other things going on. So, really, what I try and say to my patients is I want you to think about the mouth as being the gateway to the rest of your body. So there's a few ways in which I think is best for us to perhaps break this down. So if we're thinking about aging, let's break it down into several components. We've obviously, from an oral perspective, we have our teeth, we have our gums, we have the bone in our mouth, and then also we have, for example, the effects of how perhaps our oral health can then be affecting the rest of our body and the systemic links from oral health. So I appreciate that's quite a big sort of sentence to start off with. So I think let me break it down and let's start with just teeth. So obviously, as we know, dental decay is one of the biggest risks that we suffer for dental diseases, and it's simply caused by poor oral hygiene and a high sugar diet. So over time, what happens is those sugars sit on the tooth surface and they start to erode away at your outer layer, which is known as your enamel. And then if it penetrates through into the underlying tissue, which is your dentine, that's when the decay can actually start progressing. And eventually, if it gets to the nerve of the tooth, that's when you get toothache. And you may have heard, obviously, people saying they've needed to have a root canal, and it can be quite painful. Now, dental decay is entirely preventable and even reversible in its early stages. So let's think of your tooth like an apple. You've got the skin, the flesh, and the core. Decay is like a little worm. So at first it just gets into the skin, and that's fine. When decay is in that stage in the tooth, we can actually leave it. And with good oral hygiene and using things like fluoride, we can heal that outer layer and prevent that decay from progressing further. Now, unfortunately, if the little wiggly worm gets into the flesh part, which is our dentine, the rate of decay can spread much quicker. So for example, you're walking along, you see an apple on the floor, you pick it up, you see a small hole, and you think, oh, that looks fine. But then you push your thumb and there's obviously a big mushy patch of decay and rot underneath. That is essentially the progression of dental decay when it comes to your teeth. Often when it's in that early sort of stages, you don't feel any pain. You don't know that you have a problem. It's not until unfortunately we get to the pain part that you then are in big trouble because unfortunately it's reached the nerve and it makes saving the tooth a lot harder. So does that all make sense so far? Great.
It does make sense. So my first question is around, so I recently had a cavity. From what I understand is I had the cavity from a long time ago and it's fallen out
Yeah.
and it's had to be put back in. And when it happened, I was eating like a soft biscuit. Now I don't really eat biscuits very often, but I was in a conference, so I was eating a biscuit. And I also like to pride myself on looking after my teeth. And whenever I go to the hygienist, they're always like, your teeth are lovely, like keep doing what you're doing, blah, blah, blah. But they said that I have hyperplasia, and I just wanted to ask because you said it's all preventable, but I feel like I've done everything I could possibly do, and yet I still have teeth problems. So that's number one, like what's going on there, and then number two is how can we prevent kind of that detrimental element before it gets expensive. Like I'm thinking of it from a practical perspective. Yes, there's the pain element. Yes, there's like the health element. But what people associate most with teeth are, oh God, they're expensive. And having a root canal in this country isn't affordable for everybody.
Now, so you make some really good points. So as I said, we talked about dental decay, which is obviously one of the oral diseases that many will suffer from. But let's also think about how the teeth take a battering maybe in other ways. So as we age as well, things to consider are erosion, and that is the wearing away of your teeth from acid, whether that be in food, drinks, even gastro and in like from the stomach. So those gastric acids can also have an effect on the teeth. You've then got something called attrition, which is tooth wear. So obviously where teeth grind, they start to get obviously a lot smaller. And even things like recession, where the gums then start to recede. Now, some of those, for example, with the erosion, as I said, that's always acid, whether it's external or internal. Then, if the teeth have started to become thin because of the acid, that's going to make attrition and the wearing of teeth worse. And then on top of that, if you have, for example, then gum disease, or you've been brushing and over brushing and scrubbing, then you're going to get recession of the gums. Now, we lose a bit of like healthy tooth structure anyway as we age. It's just part of the process. When we think about, for example, our skin and we get collagen breakdown, it's the same with like our gums. So we're always losing a tiny bit of ourselves every day. I know it's very sad, but it is unfortunately part of the process. But what can we do to obviously slow that down? And you mentioned your hyperplasia. So remember, I was talking about the enamel being the hard outer layer. That means that your outer layer, when it was formed, wasn't quite formed perfectly as that solid matrix. So due to those micro imperfections, unfortunately just makes your enamel a bit more sensitive. Now it's the same with sort of like with gums and gum disease. We all react differently to certain things. It's called the host response. So the way in which, for example, think about, when someone gets like a cold or a flu and you're like, well, I was absolutely fine, I didn't get it. So that is just how our bodies respond and defend ourselves. So if we think about gum disease again is just caused by bacteria. Normally it all starts again with poor oral hygiene and not removing that bacteria. So when I say these things are preventable, it all really comes down to good oral hygiene, good diet. Those are the two ways everyone can obviously protect themselves. Now, a lot of these things are multifactorial, and sort of sometimes when we've got other things going on, it exacerbates and makes one of the other problems worse. So that's why it's kind of having an all-encompassing approach. Screening, checking, regular visits are always the sort of front line. So seeing someone like myself, a hygienist or a therapist, can really help patients along their way. Again, seeing the dentist regularly. But a lot of these things, if you're armed with the sort of knowledge of what you can do at home and what products you can be using, therefore you're going to minimize the risk of having any of these problems or issues. Now, again, you mentioned that you had to have a filling sort of replaced. While we do our utmost to try and make things last as long as they possibly can, eventually, they may deteriorate. I, hands up, had some fillings before my dental career kicked off, and I've actually recently had to have them replaced 20 plus years after they were first made. And we need to think about obviously the evolution that we have sort of in dentistry and healthcare as a general. The materials that we use now, the techniques we use now, they are very, very different to 5, 10, 15, 20, 50 years ago. So we're making real progress and advancements with how we approach dental care. But all of it comes down to prevention and preventing those diseases. So really, to sort of summarize what I'm saying in terms of preventing diseases, like you've got bacteria in your mouth. So think of the mouth as having an oral microbiome, just like you have a gut microbiome. It is filled with billions and billions and billions and billions of sort of like bacteria. Some are good, some are bad. All we are trying to do is keep the good bacteria happy. Because what happens is it's when the bad bacteria starts to outweigh the good, they create waste products. And those waste products are then fed on by other bacteria. So it's just like a sort of Chinese buffet going on in there. And everyone's helping themselves to various elements and parts of the mouth and the bacteria there. And ultimately, it's those toxins that the bacteria produce that either A, cause dental decay through the acid, or B, gum disease by starting to cause inflammation. And that's when you get bleeding gums, either when you're brushing or flossing. And that is your earliest warning sign something is not right.
Okay, so we've obviously covered a lot about kind of like the standard oral hygiene, like the foundational things we need to talk about. Like we do need to know about them, and it is just a reiteration of like my whole podcast is all about prevention and what we can do to optimize aging. So I wanted to focus more on the diseases that you mentioned earlier that are impacted by oral hygiene, because that's something I do not know about, and I think is really interesting to be aware about, especially for us as we age, because we're thinking about things from like a physical activity diet perspective, but not necessarily thinking about things from a, oh, my oral hygiene could impact my likelihood of developing insert here, you know? So please tell me more about that because I'm really interested as to how that's going to affect us and as we age.
Okay. So it is the kind of like hot buzzword at the moment, which is everyone is talking about biofilm, oral microbiome, and like things like even like saliva testing, which I'm sure lots of people would have heard about now. Now, as I said at the very beginning, I need you to think about your mouth as the gateway to the rest of your body. Now, quite simply, that bacteria that I was talking about, if you have high levels of bad bacteria in the mouth, and you have, for example, inflammation, bleeding gums, on the most simplest level, that bacteria has the ability to enter your bloodstream and travel to other parts of your body. Now, the main ones that we focus on, particularly from a dental perspective, and ones that have quite, the most robust evidence are Alzheimer's, heart disease, and diabetes. So with diabetes, it's something called a biodirectional relationship. And what that means is if your diabetes is not very well controlled, it can affect your gums and your oral health, and vice versa. If your oral hygiene is poor and you have gum disease, it can affect your diabetes. So it's that fine balance of keeping everything in harmony. With heart disease, it's unilateral. So it means it only goes one way, which means that that bacteria has the ability to enter the bloodstream and the heart and cause diseases like endocarditis. Same thing with Alzheimer's, it can travel to the brain. And when they carried out autopsies and studies on patients who had Alzheimer's, they found a type of bacteria called P. gingivalis, and it was actually found in some of those like brain cells that they then looked at. So I'm giving you very brief because obviously I appreciate we've only got a certain amount of time. So these are things to just sort of think about and be aware of. And like I say to my patients, your mouth is about 3 inches away from your brain and about another 6, 7 inches away from your heart. So protecting your mouth and your gums, because ultimately what that bacteria is doing is causing inflammation. So inflammation is, that can then run through your whole body. And you'll read and hear and see about patients, for example, who had rheumatoid arthritis, but through improving their oral hygiene, they managed to improve their rheumatoid arthritis. Again, patients with diabetes who improve their oral health managed to improve their glycemic control. So overall, it has an impact because of the way in which our body runs with chemicals, hormones, all those things. They're all intertwined with each other. And that's why you have to think of it not only just like from the mouth, it's what's going on through the rest of the body as well. They're also intricately interlaced with each other, but the mouth is the first point where anything kind of goes in or happens.
So why don't we know about this? Like, why is this? For me, I would like to say that I'm quite in the know about health and well-being and stuff, but I go to a hygienist every 6 months. I'm on it with my teeth, like I have a water flosser. I do as much as I possibly can, but I've never ever heard about the link between chronic health conditions and oral hygiene.
I think it's, first of all, perhaps it's a case of what we know today. And that's, we've, as dental professionals, we always practice evidence-based dentistry. So while we have a whole host of information that we've been using and learning and making guidelines with, I think we're getting to a point now where research, evidence, all those things are coming to the forefront quicker than we're able to perhaps update our teaching education as well as our guidelines, but even our public campaigns towards how we educate the public. still needs some work. And as I said, for two diseases, gum disease and dental decay, that are entirely preventable, they still rank number like 3 and number 8 in the world's top 10 non-communicable diseases. It's 2025. Like, as a hygienist and therapist, I work really hard along with the rest of my profession to help empower patients. And again, it's taking that approach that unfortunately one set of guidelines may not fit for everyone, and we need to now like approach our patient care with an overall um not just looking at the teeth, but looking at the rest of the body. And a lot of us are really striving to work towards being able to do that for our patients, and not just okay, cool, thanks for coming to see me today, brush twice a day, use some floss, I'll see you in 6 months. Because
So why?
even stress can affect your gum health.
Yeah, it's mad, isn't it? That's blowing my mind. So why is oral hygiene such a crisis in the UK? And I think it is across the world. I don't think it's just UK. Like, is it laziness? Is it lack of knowledge? Is it um like poverty that affects mindset around it, or even just accessing toothbrushes? I don't know. What is
Said
that?
all
What
of
is
them.
the
Yeah,
all of
you
them?
said all of them.
Okay.
It's difficult, we have a crisis, and obviously we could do a whole other like sort of podcast on that. It's hard, it's like, how do we fix this? Because there are solutions out there, but as you say, we have a problem where dentistry at the moment is not easily accessible, nor is it affordable. And my sole mission when I started London Hygienist was to make hygiene and dental services accessible and affordable. So a lot of people still are not entirely aware of the full scope of practice of what a hygienist and a therapist can do. So a therapist is actually a mini dentist. So I can do checkups, x-rays, I can do fillings, I can even take baby teeth out. What I don't do is things like root canals, extractions, crowns, veneers, but general routine, like sort of dentistry is kind of what we do. Something called direct access came into play in 2013, which meant that prior to that, you needed a prescription from a dentist to see a hygienist or therapist. Now, you can see a hygienist or a therapist under direct access, and we can treat you within our scope of practice. Anything we can't do, we'd let you know and refer you on to a dentist. So if you're watching this and you've been thinking, I've not been able to get into a dentist, perhaps look for a direct access hygienist or therapist who could really help work with you to perhaps, identify any sort of treatment needs that you might have, or just getting you back on track with a good, dental clean, giving you some tailored and personal oral hygiene. This is a way in which access can be gained.
And how much would that? I know it's probably different depending on where you are in the country, but let's say I'm like, I can't get access to a hygienist and I can't get on the NHS list for my local my dentist, and I just know that something's wrong with my mouth in general. One, how much is like, for example, just a consultation, and what does that range? And then secondly, just to follow on to that question, what should we be doing on a daily basis to prevent that from actually occurring? I know one size doesn't fit all, but like, what we should absolutely be doing?
Yeah, I think so. If you're definitely, depending like again on where you are, prices obviously will vary. Now, for example, if a patient came to see me and they were a new patient, I still do treatment on the day. So you will have like technically a consultation. I will examine to see what needs to be carried out. And equally at that stage, if it's like or you might need a few more appointments, or this is what you would benefit from, I would still make that very clear. However, I wouldn't then send you out the door. You would still get a clean with me. Like I still will carry out some treatment and give you an oral hygiene routine. So if we really want to think about what we can all be doing. So first of all, it's effective toothbrushing. Now, the advice is to use an electric toothbrush because you get more brush strokes per minute, which therefore makes the plaque removal and biofilm remover greater. However, if people are using a manual toothbrush, you can still do an effective job. But we say brushing the teeth, and actually we need to think about it as brushing the gums. So most people do brush their teeth, but they miss the gum line, and that's exactly where the bacteria wants to get trapped. Cleaning in between the teeth, I know we moan and nag about it with the flossing, but brushing only cleans 3 of the 5 tooth surfaces. So you've got to get in between the teeth. Now, the advice is if you have the space, those little interdental brushes, otherwise floss. And like my top tip is always if you can get the floss in, but you're worried you can't get it back out, pop it in, give it a wiggle, and just pull it through. It is still doing something. You mentioned a water flosser. Great. If you are a can't floss, won't floss, it is still better than nothing. So the more that we are doing to remove the biofilm and stopping it from tipping into that sort of bad complex, the better it's going to be. Diet is another important one. So keeping sugars and acids to meal times only. Trying to either drink water after or rinse your mouth afterwards. Even sugar-free mint and gum can really help to just reset the pH of the mouth. That's another great one. Uh, Again, trying to, wherever possible, have regular checks with a dental professional because, as I said, gum disease and dental decay, they're pretty painless and undetectable in that early stages. Even things like doing oral cancer checks at home as well, that's something to be really mindful of as we age as well. And a simple, 1 2 minute check of your mouth once a month is a great way to start. It's just pulling down the lip, having a look to see if there's any like ulcers or red or white patches, lifting your top lip, checking the tongue, left side, right side, back of the tongue, under the tongue, roof of the mouth. That's something everyone can do at home once a month just to make sure, because again, anything like an ulcer or any sort of patches or something that doesn't feel normal for you, if it's been there for longer than 3 weeks, see a dental professional.
Yeah, and I think to add to that, it's not just about kind of your standard oral hygiene that we're thinking about. It's things like cancer. And like if you're checking those things, you can see things like tongue cancer and throat cancer. And I actually know somebody who recently, they're not based in the UK, but was diagnosed with, I think, throat cancer. And the reason they found it was because they went to a hygienist. So and they managed to get it early on because of that whole situation. So not only are you managing kind of the traditional things that we think about, like root canals and all of that, but much more serious health conditions that can arise from poor oral hygiene.
It's things as well, like people don't realize quite often, some other health conditions will present in the mouth first. So, recurrent ulcers could be a couple of things. It could actually be, a vitamin or mineral deficiency or an allergy to some ingredients in, for example, toothpaste. When you get those like sores on the side of your mouth, that's called angular colitis. That's related to like quite often being run down or low iron, low B vits. So there's quite a lot that, like I said, present in the mouth first before you realize you may have some conditions other in other parts of the body. Everything even, and quite often things like, for example, like Crohn's can show in the mouth first in various ways. So obviously, I don't want to obviously do any sort of like scaremongering and things. It's crazy how the body and those hormones and the tissues and everything are connected. Like even menopause, as the hormones change with that, that can have effect on your oral health. You can get a dry mouth, and when the mouth is dry, the bad bacteria can thrive, and that's when you can get an increase in gum disease and dental decay. But also as into the menopause, things like with osteoporosis and whatnot, that can again affect the bone in the mouth. So you can see there's a cascade. And unfortunately, as we do age, if we find ourselves taking various medications, they can have effect on the mouth as well. So everything is just trying to sort of be in harmony and think about what's normal for you, and when things are not normal, trying to take a lead on saying, hey, this doesn't feel right for me, what's going on.
Yeah, amazing. So just to kind of wrap up, we didn't get to how much it costs for kind of like a therapist consultation. So what does that look like? I know that for me, when I pay for my hygienist, it can be between 50 and 60 pounds. And then following on from that is, are there any myths around oral hygiene that we should be talking about?
So first of all, in terms of cost, I think, yeah, from hygiene perspective, you are looking at entry point is maybe 50, 60, up to, into the hundreds. For a comprehensive, perhaps 1 hour appointment with a hygienist or therapist where they're going to carry out a bit more of a deeper scope of practice, you might be looking anywhere between 100 and 200 pounds. I would just call around, see who does direct access if you're not, looking to go down the dentist route. See who's in your area. There are so many amazing hygienists and therapists out there now who really want to work with patients to help support their oral health. And then in terms of,
Would sorry,
yeah,
sorry, Anna, to interrupt, but do we just search direct access and then it will come up?
yeah, if you look for direct access hygienist or direct access therapist, have a look and see what comes up. You'll be surprised. Lots of practices are offering it as a way to kind of help tackle the crisis that we've been in. In terms of myths, that is a good one. I mean, a lot of them are just, old ones like, oh, but every baby you have, you lose a tooth, and there's not really many now that I think I'm sort of worried about or hearing people come through. I think the public are becoming super mindful and super engaged with things like that oral health. Um, it's like trendy now to have good teeth, and people see it not only as part of their appearance and well-being. They really understand that actually by seeing a dental professional regularly, you are essentially buying insurance for not only your dental, for your teeth and your dental health, but your overall health and well-being.
Okay, amazing. So what would you say is the best toothbrush to use and what is the best form of flossing? Water flossing, I don't know, straight, is that what you call it? String flossing?
So again, toothbrush wise, you've got two sort of system. And if it's electric, you've got two types. You've got oscillating, rotating heads, or you've got brushes where the bristles vibrate through, and that's sonic technology. Both are great. Okay. If you're going to use an electric toothbrush, I generally say to people, don't go crazy and spend maybe sort of £50 if that's like your first one that you're going to get. They're all same really these days. Just make sure that it is rechargeable and that you change the brush head regularly. Okay, so have a little like sort of shop around and see. The more expensive they become, generally you're paying for what I call bells and whistles. So extra cleaning modes, extra brush heads, a fancy traveling case, app technology. Now, for some people, they may really want that. I personally, I use my electric toothbrush on one mode. I change my brush head every 3 months and it's rechargeable. It is simple as that because ultimately it is the technique. So just remember, half on the teeth, half on the gum. Let the brush glide and do all the work. No scrubbing, no, you know, scrubbing, scratching, anything like that. Just let it glide gently along the gum line. And then again, if you have the space, try and use interdental brushes, the little bristly ones or the little rubbery ones are still going to be doing something. And otherwise floss. I like any that are sort of like satin taped or wax because then they don't snag and tear. The thread ones tend to snag and then that kind of puts people off. And as I said, if you can get the floss in, but you can't get it back out, just pull it through. And yeah, as you said, can't floss, won't floss. You've tried it, it's not for you. A water flosser is definitely going to be doing something. And wherever possible, if you can see a hygienist or a therapist, they can really then hone in on giving you that perfect, tailored oral hygiene routine and product recommendations because one size shoe does not fit all.
Amazing. Thank you so much. And I really appreciate all of that. It's so much information. And actually, I do think we could probably have another follow-up episode just talking about something else because I do have a lot more questions. But that was really helpful. And yeah, that's it. Is there anything else you want to add?
No, I just want to say a massive thank you. I mean, obviously, anyone who wants to connect with me or ask me any questions, I'm more than happy to be of assistance wherever I possibly can. And thank you so much for giving me the opportunity to talk about something I'm so passionate about.
No worries. Yeah, so we'll have your details in the description below so people can contact you directly. So if you are interested in finding out more about how Anna can help specifically, then definitely get in touch. She seems very knowledgeable. And you are London based, so you're quite accessible for most people based in the UK. So
I can make
yeah, have a lovely
recommendations. Yeah, if it's not me, I have a vast network of people that I can always help connect others with.